All right, let's get into the prostate diseases. The first prostate disease is probably the most common. It's called benign prostatic hyperplasia, or BPH. So you'll often hear about males having BPH. This is what it stands for: benign prostatic hyperplasia. This is an enlargement of the prostate because of the increase in the number and the size of the prostate cells, but it's non-cancerous. So it's not going to be malignant. It's not going to metastasize and go to other areas. It's just going to grow. And when it grows, remember that the prostate is an enclosed organ. So as those cells grow, then the urethra, which passes directly through it, will become obstructed. And so because it's obstructed, urine cannot flow out as easily. This is going to promote bladder and kidney infections because now you have stagnant urine in the bladder. It's also going to be very uncomfortable and for some men even painful because it will be difficult for them to start a flow of urine, completely empty the bladder. They can always feel like they have an incomplete voiding, so urine in the bladder, because the urethra is compressed in BPH. And that's often how BPH is diagnosed in men. Is they'll go to the doctor and they'll say, oh, lately I've had trouble urinating. It's hard for me to start a flow of urine. Or they'll say it's hard for me to completely evacuate my bladder. Uh, well, the practitioner will say that. But anyway, it's it's difficult for me to empty my bladder completely, and I don't know why. And so then your doctor will go in, do a couple tests, and confirm that the person has BPH, or benign prostatic hyperplasia. Another prostate disease is prostate cancer. This one is the second most common cancer in men after lung cancer. So in men, prostate cancer is the second most common after lung cancer. These cancer molecules, or these tumors, will tend to be near the periphery of the gland where they do not obstruct urine flow. Which means that unlike BPH, where the entire gland will start to get bigger and you'll have the compression of the urethra, in prostate cancer, often these tumors will grow away from the urethra, so it's not going to obstruct the flow, which means that those with prostate cancer often won't know that they have prostate cancer because they don't have that change in the urine flow. So remember, I said that a lot of men will go to the doctor and will say that they have trouble starting or continuing a flow of urine. They have trouble emptying their bladder. And that's when the doctor will often discover and diagnose BPH. With prostate cancer. It's not that's not the case, because these are nowhere near the urethra. So often, because it goes unnoticed, it has the opportunity to metastasize to nearby areas. So it'll start with metastasis to the lymph nodes, then it can move up to the lungs and other organs. This is the most common routes of metastasis, or the most often seen. So the first metastasize to the lymph nodes that are near, then it'll end up in the lungs or other locations. So if a male has cancer in their lungs, they're going to go in and do a biopsy to see if those cells are actually lung cells or if they are prostate cells or other cells, so that they can know whether or not the cancer in the lungs is the primary tumor, or if it is a metastatic tumor from another location. To detect prostate cancer, the practitioner might do a digital rectal exam, also called a DRE. And this is where they're actually able to feel the prostate. So they go through the rectum, they put on a pair of gloves and they actually put a finger in the rectum so that they can feel the posterior side of the prostate, and they'll notice whether or not there's a change in the way the prostate feels or if it's all smooth and normal size. If it is a different size, if one side is larger than the other, or there are bumps or hardnesses in the prostate, then they'll do further examination because that is basically not supposed to be there. So the DRE is extremely important because the practitioner can actually feel the posterior side of the prostate and can then be able to know whether or not there are changes in at least that part of the prostate. The second part of the testing is the PSA levels. PSA levels are looking for serine protease. Remember, ACE is an enzyme, as well as acid phosphatase in the blood. All right, so serine protease is your PSA, so that's prostate serine protease. And it's also looked for, they also look for the acid phosphatase. If these are elevated, then the patient is most likely developing or has developed prostate cancer. Now, I will say that PSA elevation is not only because of prostate cancer. So having this DRE to find those nodules or the change in size of the prostate, as well as other confirmatory tests, will let you know whether or not you have prostate cancer. So you cannot completely diagnose it with just the DRE or the PSA, but using these two can tell you whether or not the person is more likely to do it, to have it. And if those things are there, those nodules and enlargement of the prostate felt by the DRE or the elevation of the PSA, if they have that, then to confirm, the doctor may go in and do a biopsy of the prostate in order to actually see the cells in the nodule and determine whether or not he has prostate cancer. So now let's get into puberty. So once the reproductive system develops in the developing fetus or after birth, once they develop, they go dormant for many years. Right, so the reproductive system is not going to be used for anything. It's just there, and the male penis, of course, will be used for urinating, but it won't be used for anything else because it is dormant until he turns somewhere between 10 to 12. And that's when boys start to go through puberty, between age 10 to 12. Girls will begin going through puberty sometimes as early as age 8, but usually between age 8 to 10. So what happens is there is a increase in this pituitary gonadotropin. All right. So the pituitary gland, you should remember from the endocrine lecture that the pituitary gland is considered the master gland. This master gland is called that because it produces hormones, many different hormones that control the turning on or the turning off of other glands. This is shown here because when you have this pituitary gonadotropin, the surge of pituitary gonadotropin by the pituitary, when that surge occurs, then that is going to awaken awaken the reproductive system. This is where you have the beginning of puberty. So adolescence is that period of the onset of the gonadotropin secretion and reproductive development to when you are a full adult or full adult height. So once you start puberty because of the surge of pituitary gonadotropin, so let me just double back. Look at the word. The word gonad, the word has gonad in it, which means that you'll know, even if you know nothing else about what's going on, you know that gonad has something to do with the male and female sex characteristics. It starts in the pituitary. And I want you to look up the suffix tropin. All right, so that you can know what tropin means. So this is how you can have an idea of what pituitary gonadotropin is, even if you had never heard the term before. All right, so adolescence. Adolescence is that period from the onset of puberty when that gonadotropin is being secreted and starts to awaken the reproductive system until the person attains full adult height, whatever that height is for them. Once they reach full adult height, they're no longer in adolescence. Puberty is the first few years of adolescence when, give me just a second. Okay, so puberty, again, is the first few years of adolescence until the first menstrual period in girls or the first ejaculation of viable sperm in boys. So that is how puberty is defined. Once these changes begin, that's the beginning of puberty until she has her first menstrual period and he has his first ejaculation with viable sperm. This usually happens around age 14 for boys and age 12 for girls, meaning that by age 12, a girl is able to actually get pregnant and maintain a pregnancy. And in boys, no later than age 14, he's actually able to fertilize an egg. All right. But once these happen, that is the end of puberty. And that's important for you to know. So let's talk about how puberty is controlled by the endocrine system. So your testes will secrete testosterone in the first trimester of fetal development at levels that are about as high as mid-puberty. So that is huge to know that the testes of the developing fetus in the first trimester of development, so the first 3 months that mom is pregnant, he will be producing testosterone from his testes that are about the same amount of testosterone as mid-puberty. Then after that, the testes become dormant, and from puberty to adulthood, the reproductive function is regulated by your links between the hypothalamus in the brain, the pituitary gland, remember that's the master gland, and the gonads, the sex the sex organs. All right. So testes will start to produce testosterone in that first trimester, then it'll go dormant, and testosterone will be produced by your adrenal glands. But then starting from puberty through adulthood, reproductive function will be regulated by the links between the hypothalamus, the pituitary gland, and the gonads. As the hypothalamus matures, it will produce this GnRH, gonadotropin releasing hormone. Gonadotropin releasing hormone will stimulate the anterior pituitary to secrete other hormones. So now we're going to get into names of hormones. Don't freak out by the length of the name. Pay attention to what the name is because it literally tells you what it's doing in most cases. All right. So gonadotropin releasing hormone is the hormone that will help your pituitary release gonadotropin. All right. So that is your GnRH. GnRH will, or it will help you release gonadotropes, I should say. So the hormones that it will help you to release or secrete, I should say, are follicle stimulating hormone, which is FSH, and luteinizing hormone, which is LH. Now, FSH and LH are found in both males and females, and in both males and females, they help to regulate, control the reproductive process. In males, the FSH will stimulate sustentacular cells that will secrete androgen binding protein. This androgen binding protein will bind to testosterone and help it stay in the seminiferous tubules so that it can stimulate spermatogenesis. Now, spermato refers to sperm. Genesis is the beginning or the formation, just like Genesis in the Bible is the beginning of how Earth was formed, how humans were formed, the first life on Earth, the first relationships on Earth. That is what Genesis is. It's the first, the beginning. So spermatogenesis refers to the beginning or the production of sperm. So FSH will stimulate these sustentacular cells that will secrete androgen binding protein, which is a protein that binds androgens. And remember, androgens are your male sex hormones. It will bind to testosterone in particular. And so now you have this complex of testosterone and this androgen binding protein that will help keep the testosterone located where it is. Proteins are pretty large. So because they are larger than these chemical molecules, they cannot easily go in and out of tubes or vessels. And that is what actually helps your body to maintain your levels of certain chemicals because the chemicals are bound to proteins. And that happens a lot throughout the body. We noticed earlier that there were things that were connected to albumin, which is the main protein found in blood. That helped those substances stay in the bloodstream because they were bound, right? And so this particular chemical is not bound to albumin in the bloodstream, it is bound to this androgen binding protein. That is going to help it remain in the seminiferous tubule lumen and help to stimulate sperm production. Then you have luteinizing hormone. This is also called interstitial cell stimulating hormone. All right, luteinizing hormone is also called interstitial cell stimulating hormone. It stimulates interstitial cells, as its name says, to produce testosterone. All right, so luteinizing hormone will help produce testosterone by stimulating interstitial cells. Excuse me. So then once puberty starts, that's when you have growth of those sex organs that were produced in fetal development but went dormant. So then in puberty, remember we awakened those sex organs and now they're able to actually grow. So the penis, the testes, the scrotum, all those ducts and all those glands will start to grow during puberty. Testosterone will stimulate the generalized body growth. So it will help the limbs grow longer so that their arms get longer, their legs get longer. That's how they get taller. Muscle mass increases. This is why males generally will have more muscle mass than females because of the increase in testosterone versus the amount of testosterone that females have. And it will also cause the larynx to enlarge. This is what causes or produces the Adam's apple. So that's the testosterone stimulation of the rest of the body to increase limb length to help him grow taller, muscle mass increase to help him grow stronger and bigger, and larynx enlargement to help his voice get deeper and form the Adam's apple. Then there's the erythropoiesis, which is a basal it will help stimulate erythropoiesis, basal metabolic rate, and an increase in appetite. Remember, erythropoiesis is what helps stimulate the production of red blood cells. You'll also have pubic hair growth, axillary hair growth, and facial hair growth in response to a form of testosterone called dihydrotestosterone. So DHT is a form of testosterone. It is worth noting that chemicals in the body, whether they are hormones or vitamins or other things, are usually not just one particular thing. So there are several different types of testosterone. There are several different types of estrogen. We typically talk about it as one thing, but just know as a healthcare practitioner that it's not just one thing. There are several different types. We just talk more commonly about those more about a particular kind, but there are several different types of testosterone, several different types of estrogen. So back to this, as the pubic hair, axillary hair, and facial hair start to develop, this also increases or changes the scent of the person. Remember when we talked in the beginning of anatomy and physiology, so AMP1, when we were talking about the integumentary system, we talked about how there are different types of sweat glands. And one of those sweat glands will start at puberty and will cause the person to smell bad, smell like an ape, apocrine glands. Anybody remember that? Remember? Anyway, so this is the associated scent, and sebaceous glands will also start to develop, and sperm production will be stimulated, and this is where the sex drive will begin. So libido will be stimulated during puberty and an increase in testosterone production. So adulthood. In adulthood, the testosterone will sustain the male reproductive tract as well as sperm production and libido. Inhibin is produced by the sustentacular cells. This will suppress FSH secretion or output from the pituitary. When that happens, that reduces sperm production without reducing LH and testosterone secretion. All right. So as he develops into an adult, his sustentacular cells can produce inhibin, which will suppress FSH from the pituitary, which will reduce sperm production without affecting LH production or testosterone secretion. So as he ages, so let's talk about aging and sexual function. As he ages, testosterone production will start to decrease. There is a peak secretion of testosterone at about 7 milligrams per day around age 20. So you all right now are around the peak of your testosterone secretion. It will start to decline after age 20, slowly, slowly, slowly. And by the age of 80, it will decline to 1/5 of that production. So divide 7 by 5. So by age 80, he is producing 1 point something milligrams of testosterone every day. Far cry from that 7 milligrams per day at peak secretion around the age of 20. There's a decline in both the number and the amount of activity of those interstitial cells that are producing. All right. So the male climacteric typically referred to menopause. All right. So it's kind of like when everything stops or shifts or declines. But know that males have their own version of menopause. It's called andropause. All right. So male climacteric or andropause can occur, and this is a period of declining reproductive function that may be seen as early as age 50. So some of your parents might be going through the process of andropause if they are close to age 50. And with that comes a sperm count decline, right? A decrease in testosterone production. So they'll have a decrease in strength, a decrease in recovery, a decrease in muscle mass as long as testosterone is declining, right? But in males, they are often still able to father children because they're still producing sperm. It's just a decreased amount of sperm. All right. So male climacteric is called andropause, which is analogous to female menopause, where your hormone levels will start to decrease greatly and will cause all of these changes in the person. So your age-related drop in testosterone and the presence of inhibin will trigger the rise of FSH and LH. Make sure you go back and reread what FSH and LH does so that you can understand this relationship better. So as your testosterone and inhibin rate levels change, you will have an increase in FSH and LH. And even though this is not noticed most time, some men will experience mood changes, hot flashes, and they'll feel like they're suffocating, right? And so again, this process is analogous to female menopause. It's just not as readily noticed in men as it is in women. But the changes do occur, and some men can have these mood changes and hot flashes and feel like they're suffocating. There's also the possibility of erectile dysfunction, also called ED. Erectile dysfunction is the term for impotence. This is where he has the inability to produce or maintain an erection that will be sufficient for intercourse. So for some men, they cannot have an erection. Some men can have an erection, but they can't maintain it for very long. So in either case, they're not able to have intercourse. This occurs in about 20% of men by the age of 60 and 50% of men by their 80s. All right. So this is what ED or erectile dysfunction is. All right, let's get into sperm and semen production. So sperm, remember I told you that spermatogenesis is the production of sperm. This occurs in the seminiferous tubules. The production of sperm involves three different things. So the first thing is to have the division and remodeling of your large germ cells. Germ cells are those less differentiated cells, or the beginning cells, the cells that become something else, into small, mobile sperm cells with flagella. Flagella is the little tail on the end that helps it move from place to place. You then have reduction of the number of chromosomes. So these germ cells start off with a full amount of human chromosomes, but they start to decrease by half in order to, let me rephrase that. So by the time they are fully matured sperm cells, they have half the number of chromosomes. The third thing that happens is gene shuffling. So gene shuffling is important because this allows for you and your siblings to look very different because the genes that your mom gives, the genes that your father gives, are going to be shuffled into a new combination so that each person that comes from those parents are not going to be the exact same person. This helps with genetic variation, right? The process of meiosis will recombine the genes and reduce that chromosome number while producing 4 daughter cells, so that those germ cells that will produce the 4 daughter cells will become 4 sperm cells, all right? So this is what spermatogenesis looks like. You have that primary spermatocyte that will undergo meiosis. It becomes genetically different, and it needs to be protected from the immune system because it is genetically different. So then it becomes more foreign, and the immune system, if it's not protected, will look for it and kill it because it's genetically different. It is foreign. All right. The primary spermatocyte then moves to the lumen of the seminiferous tubules, and then a new tight junction between those sustentacular cells will form behind it. So basically it goes into a room and the doors close behind it to protect it from the blood testes barrier. It will protect it from the immune system, being protected by the blood testes barrier. Semen, are also called seminal fluid, is the fluid that surrounds the sperm during ejaculation. The body produces 2 to 5 milliliters of fluid during an ejaculation. 60% of that is seminiferous seminal vesicle fluid, 30% is prostatic fluid, and 10% is sperm and spermatic duct secretion. So remember when we talked about the seminal vesicles and the prostate, this is where that fluid comes in. 60% of the ejaculate or the fluid around the sperm comes from the seminal vesicles, 30% from the prostate, and 10% is sperm and other secretions. Now, sperm count in ejaculation. Normal sperm count in each ejaculation, normally there should be 50 to 120 million sperm per milliliter of ejaculate. Anything lower than 20 to 25 million is considered infertility. It will be hard, if not impossible, for him to conceive if his sperm count drops lower than 20 to 25 million sperm per milliliter of ejaculate. So let's go back to the different glands and what they produce. So the prostate produces the thin, milky white fluid. Inside this fluid, you have things like calcium, citrate, and phosphate ions. You also have clotting enzymes. You have protein hydrolyzing enzymes called serine protease. This is your PSA, prostate specific antigen. So all of those things are produced by the prostate. Now, we talked about the PSA in cancer, in prostate cancer, but because this because the prostate produces this PSA, this prostate specific antigen or serine protease, if it is elevated, it can also indicate BPH or prostatitis. So it depends on what's going on, but just know that the prostate is what produces this. The seminal vesicles will contribute a fluid that is more viscous, meaning thick. Make sure you look the word up so that you can know what viscous means for yourself. It's also yellowish. This contains fructose, which is the main sugar that the sperm cells need to survive, as well as other carbohydrates. It contains citrate, prostaglandins, and a protein called proseminogelin. All of this is produced in the seminal vesicles. The stickiness of semen is what helps to promote fertilization. There's a clotting enzyme for prostate activates called proseminogelin. It converts it to a sticky fibrin-like protein called seminogelin. So remember, anytime you have pro in front of a word, that is the inactive form. So this is activated to form seminogelin. This entangles the sperm, helps it stick to the inner wall of the vagina and the cervix. This ensures that the semen doesn't go back into the vagina. So as it's moving upward toward the cervix and the uterus, you don't want it to slide back into the vagina. It promotes the uptake of the clots of semen into the uterus. So because it's real sticky and it has all that stuff in it, that's going to promote that uptake of that clot into the uterus. 20 to 30 minutes after ejaculation, the serine protease from the prostatic fluid will break down that seminogelin and liquefy the semen. So it will have this sticky clot that will help it to stay in the vagina and not slide out, as well as help it to be taken up by the uterus. But after about 20 to 30 minutes, the enzyme will start to break it down so that it can liquefy it. In order for sperm to move, remember it has that flagella on the end that promotes motility. In order for it to move, you have to have two things. You have to have an elevated pH as well as an energy source. So semen is more basic, all right? All right, semen is more basic. The prostate fluid is going to change your vaginal acidity from 3.5, which is the normal acidity of the vagina, so more acidic, to 7.5, which is more neutral. So it does that so that the sperm can live, because the sperm can't live in that very acidic environment. It does that so the sperm can live, and yeah, but it changes the pH of the vagina. The seminal vesicles will provide the fructose and other sugars to that mitochondria in the sperm to help it produce ATP, because in order for the sperm to continue to move and fight through all the barriers it needs to fight through to get to eventually an egg and hopefully fertilize the egg, it takes a lot. So it needs a lot of food sources in order to do that. The active sperm will then crawl up the vagina and into the uterus, up the uterus. And these prostaglandins in the semen will help to thin the mucus of the cervical canal, because she will have mucus in the cervical canal that will protect it and will decrease the amount of things that can go in and out of this or through the cervix. So the prostaglandins will thin that mucus so that it will help to spread the semen into the body. And we will continue the lecture on the next video.